President Mohammadu Buhari on March 30, 2020, ordered the lockdown of the Federal Capital Territory, Lagos and Ogun states as part of measures to contain the spread of coronavirus in Nigeria. 5 weeks after, the president in another nationwide broadcast announced the phased easing of the lockdown with conditions to be released by the Presidential Taskforce on COVID-19. Some of the guidelines include mandatory use of face masks in public places, ban on interstate movements, social distancing, among others. However, recent developments indicate abuse of the guideline, as seen in viral videos in marketplaces and banks across the country. Arising from its meeting, which deliberated on a range of issues pertaining to the management of COVID-19 in the country, the Labour Civil Society Situation Room at a news conference in Abuja attributed the violations to failure on the part of government to face the lockdown relaxation by sectors.
The failure of a lockdown relaxation by sectors and absence of sector-specific guidelines on the lockdown, which has led to overcrowding of people at public places such as banks and markets.
President of Labour Congress, Comrade Ayuba Waba, who spoke on behalf of the Situation Room, also raised concerns on the increasing number of infected health workers.
The number of infected health workers in Nigeria have been on the rise, and currently there are almost about 300 health workers exposed or infected with COVID-19. This is due to the dearth of personal protective equipment and also absence of specialized and continuous training on effective management of COVID-19 at all levels, including states and local governments.
While issues like inadequate testing centers and kits for COVID-19, unrest in some isolation centers, emergency of Kano as a new epicenter, and deportation of Almagiri children across many states in Nigeria were in the top burner of discourse. The Situation Room, however, made these demands.
We emphasize the need for sector-specific, gradual, and evidence-led relaxation of lockdown in different states of Nigeria. This is in order to avoid overcrowding in public places with the attendant risk of worsening COVID-19 incidences. We reiterate the call for prioritization of adequate supply of personal protective equipment for frontline health workers at all levels of healthcare delivery, be it primary, secondary, and tertiary healthcare. We call for specialized and continuous training of health workers on COVID-19 management, also at all levels.
It further called for community-based and decentralized contact tracing, testing, isolation, and treatment. CNN News.